Familia. What a pleasure to be with you. This is a special edition here. We're talking about things that probably we don't think about them as health, but they're extremely important and related to us as healthcare providers, no matter if you're a frontline staff or you're a physician or an advanced nurse practitioner or even in mental health. All of us play a crucial and critical part in healthcare. I can tell you for sure that as a physician, I can move the needle for 20% of the healthcare. Even if you give me all the trillions and billions of dollars and all the technology, I can only move a little bit. Then today we are going to talk about the key and part of the solution to make sure that that 80% of your health and wellness is taken care of. Today, I'm going to invite someone that is very special, someone that I have had the pleasure to work with for almost a couple of years. And I'm bringing here Dr. Bhatia. Dr. Bhatia, tell me, how are you?
Dr. Shapiro, it's great to see you. Honored to see you. I'm doing really well. I'm doing really well.
It's a pleasure to have you here. I gave a small introduction about healthcare, but most importantly, talk to us who you are.
Yeah, my name is Aliya Bhatia. I'm the executive director at an organization called Vot-ER and Civic Health Month. And along with an incredible group of health professionals like Dr. Shapiro, we help hospitals, clinics, departments of social work to support their patients and clients to register to vote and ultimately to vote and make sure that their voices are heard in the political process.
That is awesome. That's awesome. And, we have different pathways. How did you ended up doing the things that you're doing?
Cue the perfect background noise because it is an exactly perfect musical accompaniment for this story. In December of 2019, I was actually on an ambulance ride-along, and most of my background was education and consulting. I'd done some work adjacent to healthcare, but I'd not worked directly in healthcare. And I land up getting a chance to go all around my hometown, Metro Atlanta, with the emergency medical services at our safety net hospital. And when you go on that ride-along, you see so many pieces that, Dr. Shapiro, you just said, there's so many pieces of health that are not related to the 20% in the hospital or in the clinic. And you see these EMS services and these ambulances working to respond to those many issues: homelessness, lack of availability of good food in a neighborhood, insurance changes. And so something happens to what the patient needs or their medication. And I was so overwhelmed by the many things I saw. And at the end, I turned to the manager who had been so kind as to take me on this ride along and was narrating everything we saw. And I admitted to him, I'm a little overwhelmed, but if we had to prioritize and you had a magic wand and you only got to wave it once and then the magic wand goes away, what's the one thing that you would do? And he said, the one thing I would do is all my patients would vote. If I could wave my magic wand, all my patients would vote, and then affordable housing would be well funded. We'd have better job training in the city. Every neighborhood would have a good grocery store. And when I needed to get people in ambulance, I would have the funding to do that. And a month later, I hear about this organization, Vot-ER, that's doing healthcare-based voter registration, voter engagement. And I was like, that seems like serendipity. I guess I'm doing this new thing and taking it from there. And that was 2.5 years ago. I think you're on mute.
Yes, I was. Yes, I was on mute. But you know what? That's amazing that you created all this stuff, and usually the solutions come from within. Those are the best solutions when you actually see and you ask the correct questions on the community. And how is it going?
It's been a really, really incredible journey. In 2020, we had the opportunity to impact 47,000 Americans before the 2020 election. And then coming into this year, we have now hundreds of hospitals and clinics. And of course, one of our incredible partners is AltaMed. And our partnership there has enabled us to serve so many new types of partners. We now have a grant program for community health centers. We now have much higher quality materials for Spanish language speaking patients. And we've just completely upgraded and changed our work over the last 6 months.
And what was when you started going to physicians with providers, what was the initial response at the beginning? Because I know I have my own journey and I can actually share it after, but
Oh, I
um,
love that. Yeah.
what was your feeling?
Yeah. So remember that we started in 2020, and many of us, our memory of 2020 is probably marked by a few critical moments. The first moment was around March 11th, 2020, when the World Health Organization declared COVID a pandemic. And at that time, originally, we already had the idea. We were already helping hospitals with this. But what we realized as COVID became a pandemic was that health professionals were seeing this 80% that you were talking about, Dr. Shapiro. They were seeing that with their patients who were experiencing COVID. They were seeing that they were putting more Black and brown patients on ventilators. And it had nothing to do with that individual's behavior, but it had to do with the circumstances around them that shaped their health. And that was when many health professionals said, we need to do something, and we're not sure we can do that something in our health space, because when it gets here, it's too late. We need to do something that gets out ahead of this. And Vot-ER offered the opportunity for them to help their patients be heard through their vote. And that was a way that they chose to take forwards and to make sure that all of their patients had that political power. So that was, one moment. And then another moment that we remember from 2020 was a heightened understanding of the depth of the racial history of this country. And as part of that, again, many healthcare professionals, they wanted to do something. And that was how they stepped into that work, was to do something around political power.
That's amazing. And I have had the pleasure to serve as a doctor in Mexico and also in the US. And as a doctor, I can tell you for sure that we talk about a lot of difficult things, right? We talk about HIV, dead and dying, and even the best things about life, about you're pregnant, there's a life cooking inside of you, and we'll be gladly to help you the entire next period of your life and the following probably 100 years after. And sometimes when they ask me at the beginning if I would be willing to talk about voting, I can tell you for sure that at the beginning I had that spiky feeling, and I reflected. I have all these conversations. I share horrible news, and I share the most intimate parts of life with my patients and stories, and with the families. Why not talk about voting? Comparing all the feeling and pressure and serenity of the other topics, voting also, it's such an amazing charged thing. And a lot of people were like, well, okay, are you going to be talking about politics? Like, no, of course not. It's the same thing that I tell everybody, like, please, if you're going to a place that doesn't have, like filters for water, boil your water. That's health, public health, safety, taking care of yourself. The same thing with voting. If you want to drink, alcohol instead of water, well, that's that will be your choice. But my thing is to make sure that at least we create that wellness of that wellness conversation, that path of where I belong and where I want to be, and then it clicked. It clicked. If I'm 20% of healthcare, and if you give me trillions of dollars, the best specialists and everything else, I will still lack the magic that happens when they walk out of my clinic, that 80%. And if I wanted to be a doctor that actually made a difference, I needed at least to give that keys to my patients. If they use it or not, that's another conversation, but at least to give them the keys. This is the path, this is the keys, that's the door, and see what happens. And it has been amazing, and I have my
your Vot-ER badge right there, and
I have my kids here.
Oh wow! And we can play
here. And I have, I have been using it for the past, couple of almost 2 years, and it has been interesting because at least for my patients, I can tell you for sure that it's awesome when they see different languages, they see colors, they see flavors, and a lot of doctors, and this is actually the way that I approach it. A lot of doctors will go like, yes, I will show that, I'm done, thank you, and that's perfectly fine. But there's other doctors that actually engage a little bit more and go like, well, the website and everything else. And the idea is just to ask. If you don't ask, we do not know. We do not know. We cannot change things. And that's the thing that I love with this, and actually the Vot-ER and the partnerships with community health clinics with Altamed, it does change a lot of things that we can do for our communities. Last thing, because we are running out of time, let me know what are your thoughts. Where are we going with Vot-ER? What can we help us as providers, physicians, healthcare providers, mental health providers, dentists, and the entire list of anybody that is actually in healthcare? How can we help?
Yeah. So if you open up that website, the Vot-ER site, it can show you two really important links that everyone should know about. The first is if you go under Get Started, it'll say to go ahead and get a Vot-ER badge. And what that'll do is it'll get you a badge that is actually, it's personalized to you. You'll actually be able to measure how many patients that you help with this badge. And it's a very simple and easy tool. And we had this incredible experience where this already engaged person, they'd already been trying to do voter registration in health. And when they used their badge, they were able to register so many more people because it's just more efficient. And then the second thing I want to show you, if you go under resources, you'll see conversation starters that are available in both English and Spanish. And what's really important is that in today's world, there is some skepticism there about the importance of voting. There is some kind of question of what does that mean? And so it's really important that when we talk to patients about voting, that we understand the reasons why some folks are more excited than others. And we make sure that we talk about voting in a way that actually gets patients engaged around the power that vote can have. And so what we do is we provide these talking points that help our healthcare professionals use research-backed language for those conversations. And the reason that's so important is that this fall, so many decisions that used to be national decisions are going to be pushed to local levels, and every state is having some local elections this fall that you can participate in.
And thank you for that, Doctor. I'm very grateful to be part of this, and thank you so much for your efforts. Vot-ER, that's the part of the stuff. They're amazing in Instagram. Then make sure that you follow them. That's their website, and it's part of the efforts that we're doing also in Altamed with My Vote, My Health, to make sure our communities are represented and they know and they have those key structure make and improve the healthcare of the community. Thank you so much, and hope to see you soon, because I think that we are going to be having a couple of busy years.
Busy years. Thank you, Dr. Shapiro. Appreciate you.
Always a pleasure. Familia, well, right now we are running on the last part of the show. Thank you so much for hearing us. Send us your comments, questions, anything that you may need. This is for you. As you know, healthcare plays an entire role wherever we are. We are where we live. Then if we actually are trying to make a difference on where we're moving, the things that we're doing, and most importantly, the future of our kids, it starts now. Then as providers, we can actually move 20% of the healthcare, the wellness of any patient. Then remember that the magic starts when our patients actually leave our offices, our hospitals, our institutions. Then that's why it's so important to continue vaccinating against fear with that dose of truth. And thank you so much for being here with us.